We're going to review some of the muscles that we assess when evaluating a hip MRI. In this case, we have a T1 sequence of a right hip. It is an axial plane, and I wanted to draw your attention to a couple of tendons and muscles here that we look at. First of all, I wanted to point out the iliopsoas muscle and tendon that you see right here. And I had some labels here that are not apparently showing on this screen, but this one is going to be the iliopsoas tendon. And the reason I wanted to point this out, there's a syndrome called the snapping hip syndrome, and I don't think it's necessarily well understood in terms of the exact mechanism. Some people describe that you can have an interarticular snapping hip syndrome, in which you have some labral tears, and when there's movement, obviously there's a snapping movement that people feel. There's a lateral one in which there's some rubbing with the greater trochanter here, and that can happen from the gluteus medius, or some people even can attribute it to a tensor fasciae lata, which you see here. Then last but not least, you have the rectus femoris, which we also assess. So you can see here, we're just reviewing three basic structures in relationship to the hip here. So let's go start from the top. Let's go here. We have the iliopsoas tendon. We're going to follow it slowly. We're going down, moving down, 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 down. Now we see here the hip. I'm going to go a little bit up. Here it's part of the iliopectineal line, in which we can have that snapping movement, in which this tendon can potentially move over this prominence here and give the patient a feeling of a snapping hip, or potentially some action happening here with sliding of this tendon that could also cause some snapping hip syndrome. So we reviewed already the iliopsoas tendon. Now going to the rectus femoris. We're going all the way to the top. So I'm backing. So starting from the top, and now I'm moving slowly down. We can see it come down towards the right hip. We can see its association here to the hip, and down, and then to its attachment there. And then we mentioned the tensor fasciae lata here, and I'll take the end of this video to review some of the gluteus musculature. So the attachment to the greater trochanter, and here some patients can have greater trochanter bursitis or inflammation. That's the gluteus medius. Here this larger muscle is the gluteus maximus, and gluteus minimi, it will be this structure right here. So you can see something that initially can look somewhat intimidating. It's pretty straightforward once you start on a step-by-step basis, and when you have the structure that, like the hip, in which you're trying to assess how all these muscles attach and relate to the hip, it gives you a central foundation, and then you can easily identify all these muscles as you go along. So that's it for this video. Don't forget to subscribe, and we'll have some additional videos on anatomy and also MRI in general. Thank you.